If you're dealing with constant aches and pains in your joints and muscles, before you turn to medication or surgery, my next guest says his treatment goes to the source of the problem and can help your body heal itself. Welcome back, Dr. Tony DeRamus with Sandstone Chiropractic.
Good to be here.
All right, let's just, every time I've asked like doctors what brought them to the area of practice, oftentimes there's a personal story. You have a personal story.
Yeah, you know, actually mine at the beginning it's kind of funny. It was about sports, and I knew that chiropractors did pretty well financially. So I said, well, let's go that route. But what happened to me is when I got into chiropractic college, I realized this is a true lifestyle. This is something that can help people beyond just athletes. And since that point, I've just been absolutely in love with it.
Yeah, yeah. In fact, you had a back injury years ago?
Yeah, I was lifting weights when I was 21. Went into the gym, felt something, didn't feel quite right, took 45 minutes to walk out, laid around for about 3 days and went to a chiropractor. And at that point, they didn't really explain things as I should. I thought that when I went, I was supposed to be out of pain immediately. Yeah. and I walked out in just as much pain.
Sometimes that does happen. It happened with me. I was out of pain immediately. But
yeah, and with me it didn't work. So of course I said that doesn't work. So in the process, I developed this just relatively nasty back condition, which a lot of people do. Where, once a month laying in bed, curled up in a fetal position, pain down my leg. And it wasn't until I got into chiropractic college that I was starting to be adjusted regularly. And so at that point, completely forgot I even had a problem with it.
Yeah, yeah. All right, when you say chiropractor, that means so many different things in people's minds. Clarify that for us.
Yeah, chiropractic is changing a lot. And in fact, I refer to the second generation chiropractic that's coming about. But primarily what we've been focused on is the spine. And how it moves, how it sits, the impact it has on the nervous system. But now we're going outward in the body and specializing in areas, knees and shoulder and extremity work. So it's changed quite a bit. Yeah. But the basic premise is we want to remove stress on the body because we put too much stress on it today, and then improve function overall.
Yeah. And it's a real doctor. You got 4,200 hours of student-teacher contact, 4 years, 12-month clinical internship. Yeah. So you are being educated, and it's a real doctor. Let me just make that point.
Absolutely.
Okay, so when you talk about chiropractic medicine, you mentioned that it's not just the spine, and you're right. I mean, I had an issue with my shoulder, an issue with my knees, and I had 2 doctors say we're ready to operate, and I thought, I don't want to cut in there right now. Ended up at a chiropractor, went away.
Absolutely.
So there's different areas of the body, as you mentioned, and there's different technologies today than there may have been in years past. Let's talk about, for example, laser therapy.
Yeah, so I've been in practice for 18 years, and we're now seeing therapies that are coming along that are actually accelerating this process that are really powerful. So therapeutic lasers have been up and coming, but now we're using high-end lasers to where you're reducing pain and inflammation 3 to 4 times as fast. You help tissue repair on a quicker basis. So when you deal with extremities or the spine, in addition to that lack of movement, there's always tissue damage around that, and you have to find out ways to improve that.
Well, my rear delt was torn, and if you ever torn a muscle before, that is painful, and it just forms scar tissue, and it doesn't get any better. It was that laser that opened stuff up, basically getting, I guess, blood flow, oxygen, which is healing, right?
Yeah, and what's really interesting about the lasers is if you catch it at the right time after an injury, it's actually going to help prevent the scar tissue from building up, and that's what gets most people later on is that lack of mobility in the tissue.
Right, right. Yeah, people who have the frozen shoulder.
Yeah, frozen shoulder. Big deal. Yeah.
And that can be fixed?
We're doing things only because we're understanding the brain a lot better. And so we have techniques now that we can take a frozen shoulder, which typically takes 18 months to release, and it's very painful.
And a lot of rehab and stuff like that, right?
When I first started in practice, we tugged and pulled on these things for 8-9 months and improved range of motion, but not to the degree we do now. We can actually take the brain and unlock that shoulder within 2 sessions now, and it's absolutely amazing to watch this, especially the person who's had it for several years. So we can do things now that we weren't able to do back then, just because the understanding of the body is increasing so much.
Yeah, is that using neurofeedback, or what's your neurofeedback program?
Neurofeedback is really the newest technology that we have. I've been looking at this for over a year and a half, and it's fascinating me because you can actually measure the frequencies in each lobe of the brain, and based on if these frequencies are either too high or too low, there's going to be associated with certain neurobehavioral problems. Now, once we establish the frequency abnormalities, then we take them through a retraining program of neurofeedback, where they're essentially watching a movie, their brain is hooked up to the movie, and if they go out of the frequency range, the movie doesn't play. So the brain unconsciously learns how to be within those frequency ranges over time.
Yeah, that's something that would have sounded like science fiction years ago. Even using lasers, because you watch Star Wars, you go, well, the laser I saw cut the man's arm off. What do you mean? What do you mean lasers? But it doesn't do that.
Yeah,
and it's not painful.
Yeah, not painful at all. Not painful at all.
All right. So just overall, basically, you're helping the body help itself. How many times have you met people who went ahead and had the surgery, and there are times when that's needed, but the surgery could have made things worse?
That happens quite a bit. You know, in particular when we deal with, say, spinal fusions, which are a very aggressive spinal surgery, the surgeons have estimated that 50% of all these surgeries are necessary, and then only 50% of those fusions work. So we're dealing with a lot of failed back syndrome issues. So yeah, sometimes it can make the condition worse, but not all surgeries are bad. If we can, by chance, look at it and say, what caused this to begin in the first place?
Right.
Usually it's a movement issue. You know, there's some positional issues causing too much stress. If we can catch it then before it wears the area down, requiring surgery, that's going to be much more effective and also better for the patient long term.
Yeah, we oftentimes think of the aches and pains associated mostly with adults, but a lot of kids too. Something as simple as kids carrying backpacks. Like, so we have some young people in the audience today. Your backpacks weigh a ton. What is up with that, right?
Yeah.
We see like third graders with back problems.
Yeah.
But also, of course, we're a sports nation, especially here in Texas, so you see a lot of children as well.
We see a lot of children. Our facility, you know, chiropractic is beginning to specialize, and so we have 2 pediatric chiropractors on staff. I'm a sports chiropractor, and so we're looking at things maybe a little bit differently, but with the same philosophy.
Yeah, you were voted as one of America's top chiropractors, so congratulations.
Yes.
Congratulations on that. And we know that you have worked also with a chiropractor for the Houston Texans cheerleaders.
That is my claim to fame.
Yes, and so I was hoping, like, if you just did a couple of things on me, am I going to turn out to be like
yes,
that you can just make us into?
They weren't cheerleaders when we met them, no. Yeah.
But you're also currently a member of the Houston Rodeo Sports Medicine Team, which we know Houston Rodeo is about to kick up and start.
You bet.
Which that's a very cool program as well, because you can be on all different types of committees.
Yes.
But when you have like the Bronco Billy out there, you guys are responsible for putting them back together.
Yeah, absolutely. Dealing with athletes is by far the most fun I've ever had. These rodeo athletes are tough.
Yeah,
tough guys.
Get them back in the saddle.
You bet.
All right, Dr. DeRamus, thank you very much.
Thank you. Thank you. Thank you.
More about chiropractic care, and to find out if it can help you and help you to avoid surgery, help you to avoid those pain medications, visit sandstoneChiro.com, or you can call this number, 936-851-1631, 936-851-1631. Coming up, new technology.